Okay, here we go. This is the one and only lecture on the lymphoid system, chapter 22. This is the last lecture of 232. Start with an X-ray. What do you see?
Not an X-ray.
CAT scan. You're right. First extra credit point. Just kidding. What do you see? Miss Garside? Yes, ma'am.
Is there a massive fluid in the dark area?
Is there a massive fluid in the dark area?
Dark upper right corner or portion?
You mean this thing here?
No.
Over here?
Fluid?
Nah, not really. I think it's fat. You can see omentum. What are we looking at, first of all? What part of the body is this? What? The thoracic, the chest? No, it's not. It's the upper abdomen. Okay, you can actually see this is a little bit of lung right down here behind. This is the diaphragm. See that line right there? And this line right here, that's the diaphragm on both sides. And just above the diaphragm, of course, is always the lungs. So these are some ribs, these white things that we catch on an angle. There's the rectus abdominis muscles out in front. Here's the vertebrae. Spinal cord lives in that hole right there. Actually, you can see the aorta, vena cava, right back there. Okay, anything else you see? Excuse me? Fluid where? Stomach. This is the stomach, I'll tell you. Before you take a patient in for a CAT scan, most of the time you give them a little bottle of what's called gastrographin. It's radio opaque so that x-rays don't go through it. It shows up really white. That's what this white stuff is here. And you notice that all the white stuff is staying in the stomach. So you do that to make sure the patient doesn't have a ruptured stomach or something. And if so, there would be white out in here and out in here. Anything else? So this is air. This is an air fluid level. Okay? So it's air above, fluid below, and it's a nice straight line. It's the way it always is. What else? Well, on the right side, what would you expect to see over here? This is the right side of the patient. What? The liver. Exactly. So this is the liver out here. And so what would you expect to see on the other side? This organ over here. The spleen, correct. This patient has a ruptured spleen, and the reason you know that is because, first of all, the spleen is kind of milky looking here, or a little opaque looking, but you notice there's a whole bunch of extra fluid outside the confines of the spleen. So this is the spleen, this big right here. This is all blood out here. This patient is bleeding to death from a ruptured spleen. The blood is not all staying on that side of the abdomen. No, some of it has gone over here because you see the liver here, and you see the liver comes out to this point, and then from there to the abdominal wall is blood. So this is a patient with a ruptured spleen after an accident. The spleen is one of the biggest organs in the lymphoid system. The spleen, the thing about the spleen is it doesn't stop bleeding very well. If you get it torn or ripped, seat belt, kicked by a horse, kicked by another football player, you can rupture it. We try really hard to save spleens. We didn't used to. We used to just take them out, drop of a hat. If they were bleeding a little bit, we'd take them out. But over the 30 years I practiced, we got to where we tried very hard to save the spleens because we know that it plays a role in immunity later in life. And so, especially if you take the spleen out of a kid, they have real problems later in life. Or they can have problems, not necessarily they do. So anyway, Pathogens. What are pathogens? Let's talk about that. Those are things that cause disease. Microscopic organisms that cause disease. That's simple enough. Patho means disease, right? Remember that? Pathogens. So the pathogens can take the form of viruses, bacteria, fungi, funguses, and parasites. Now, each of those types of pathogens attacks our bodies in a different way, and we have sort of a different mechanism for fighting them. First of all, let's talk about what do you have that helps you fight disease? What's the first line of defense that we all have? And probably the first line of defense is our skin, our mucous membranes, the inner lining of our mouth, and so forth. And the secretions of our skin, the mucous membranes that protect us, make it smooth, and have some antibiotic properties in some of them. Now, a point I want to make here that you'll probably hear me say this again in 233, but I think it's important that you realize that, this is outside of our body, this area out here, and that is not in our body either. In fact, if you go all the way through your bowel, you've never really gotten into our body, right? Because stuff that's on the inside of our intestine really isn't part of us yet until it gets broken down and absorbed. So there's a lot of things that we can swallow. We can swallow marbles, and they just kind of pass on through and go on out. We can swallow lots of bacteria that just kind of pass on through and go on out. And unless there's a tear in the mucous membrane or the skin or the lining of the stomach or something, then they really aren't part of our body. So just always remember that the mucous membranes, which line the inside of the stomach and the intestine and the colon and all that stuff, it's really not in our body. You think of it, don't you? You think of, oh yeah, I just ate that big lunch, it's in my body. Well, it's not until it gets across the membrane from the outside, so to speak. That was good. What are the functions of the lymphatic system? A lot of what we're going to talk about is draining that extra fluid that we talked about the other day, the fluid in the lymph vessels, and we'll talk about people that can't remove all that fluid and end up developing edema, too much fluid. Our lymphatic system also is really cool in how it transports fats and lipid-soluble vitamins out of our digestive tract through these little tiny lymph ducts that are called lacteals. Lacteal means milk. Okay? Now, so here's my story on that. If you know, most of the time when we operated on people, they had been held NPO since 10 o'clock the night before, since midnight. So they hadn't had anything at all to eat. And so anything they had eaten, they had already digested, and you'd like to think their stomach is nice and empty. Their intestines are pretty much empty, and so forth. However, once in a while you'd operate on somebody that had just been through the drive-through lane at McDonald's, and 30 minutes later they got involved in a car accident and they end up in the hospital with injuries and they end up getting an operation. And the thing that was always so striking about that, seeing somebody that had just eaten, was that their intestines were just literally covered with these little white hair-like structures that were white, and basically what it was fat in the lacteals. The fat they had just eaten is absorbed directly through the wall of the intestine, and it's absorbed as literally as fat droplets, and that's what lacteals are. And you can see them really easily if somebody has just eaten. Otherwise, you don't usually see them very well. The other thing the lymphatic system does for us, it facilitates our immune response. We have a kind of a sophisticated way to fight infections besides just the simple things like skin to keep bacteria out. We have a very fancy system of antibodies and lymphocytes and so forth that specifically attack certain bacteria. The lymph system also functions to filter all this tissue fluid. So all this extra fluid that comes through our, this loose in our interstitial fluids is absorbed by our lymph vessels, and it's just like another capillary system, really, except it's a one-way capillary system. It doesn't go out and back, it just goes up. These lymphatic vessels pick up the tissue fluids and carry them up and put them back into the venous system. Be honest with you, you almost never see these lymphatic vessels. They are so tiny. Occasionally you'll see them if you cut a bunch of them or cut a bunch of lymph nodes out, then you may actually be able to see the water, the lymph draining into the site. But usually you don't even see them. But that helps get that extra fluid out of our legs and feet especially. So the lymphoid system in total, let's think about what it really amounts to. It amounts to these fancy lymphoid system cells that respond to different environmental pathogens, to toxins, and to abnormal body cells. I think that's really important to realize that your lymphocytes and your lymph nodes and your lymph vessels pick up cancer cells that are in your body that are cancerous. And they take them up through to the lymph node, and the lymph node eats them up. And it does that over and over again. Probably every one of us in this room has formed 2 or 3 cancers today. Those 2 or 3 cancers that we formed, our body recognized those cells as abnormal, and we phagocytized them and ate them up. Okay? Now, obviously, sometimes cancer kind of overwhelms us if our immunity is not up to speed, and so a simple thing can become a big problem. But really, that's all of our dead red cells and all of our body cells that play out and give up the ghost at the end of their lives have to be picked up and cleared out by the lymphoid system. We have a specific defense system which is made up of the lymphocytes. The lymphocytes are very important in the immune response. Now you saw lymphocytes when you looked at the blood smears, remember? The lymphocytes are the smallest of the white cells. The thing to remember about the lymphocytes and really all of the white cells is they don't always live in the blood. You see them in blood smears, and so you think, oh, well, they live in the blood. Well, they do and they don't, because they spend much of their life not in the bloodstream, but rather out in the tissues. So you remember when we were looking at that stuff called loose areolar tissue? Remember it had phagocytes and had lymphocytes and had mast cells and fat cells that were kind of out in the tissue juice that was around running through there. Well, that's the way it works. Is the white cells can go to an area if they need to fight an infection. They'll go to an area to fight them. Perfect example of that is pus. Pus is nothing but a bunch of white cells. If you put a splinter in your finger and it breaks off in there, and it's going to gradually fester. We call it festering. It gets red around it. It starts hurting. Pretty soon it sort of develops a little pus pocket around it. And all that is just a whole bunch of white cells from all over your body kind of go into that one place to try to fight that infection. And sometimes it can overcome the infection, sometimes it can't. Usually once it gets to the stage where there's a bunch of pus, you end up having to lance it or drain it eventually to let it out. But nonetheless, that's an example of our body using its specialized tools to go after, stop an infection. What is immunity? Immunity is the ability to resist infection and resist disease. Really, all of our body cells are involved in the production of immunity, not just the lymphoid cells. You need good blood cells, you need good oxygen, you need a heart that pumps good. All of those things actually are going to contribute to you being able to fight off diseases and keeping you healthy. So I just realized, just think that the immune system is actually very extensive and a very big deal. We have 2 categories of these defenses, though, and let's talk about them one by one. The first one is we call non-specific defenses. And that means they don't actually go after one particular infection or one particular bacteria or one particular, they're just kind of non-specific. And believe me, anytime you get most any injury or any problem, your non-specific defenses are going to be called into fight the fight. Other diseases that we try to fight but we can't do very well, we really need our specific defenses. And one of those would be the common cold or the influenza virus. And those viral cells start killing off our cells. That's what gives us a sore throat and makes us feel really crummy. And we're going to really have a struggle with that disease. But if we have already seen that disease before, either we've gotten a flu shot or we've had the flu before that's close to this type we've got now, our body's going to have antibodies around that are just going to go and just kill those viruses, and we're done. We are basically immune if we have the right kind of antibodies around for it. Let's just talk about the non-specific defenses here very quickly. Physical barriers, obviously the skin is a good one. There's also some secretions on the surface of the skin usually that also help keep bad infections out. Dry skin doesn't fight infection as well as nice moist skin, and so you women spend millions of dollars smearing crap all over you to make you softer, more cuddly, whatever. Anyway, phagocytes are kind of non-specific. They just go after and pick up things. You know, they find a dead cell laying around, they eat it up. They find a bacteria laying around, they eat it up. So that's monocytes, eos, macrophages, neutrophils, and fixed macrophages. Well, you don't have to memorize that list, but you know a little bit about these white cells already. We also have a set of cells called the natural killer cells. Natural killer cells, their job is to go in and kill any abnormal cell. So if you have a cell that, for example, is not doing well, it's old or ready to die, the natural killer cells, the NK cells, will go kill it and eat it up, and it'll be gone. It also is useful in fighting infections, because if a cell has got a virus in it and the cell is no longer normal, then the natural killer cells can identify that cell as abnormal and go in and kill that specific cell. So that's kind of a cool thing that natural killer cells can do. Interferons, they increase the resistance of cells to viral infection. They slow diseases. Interferon is actually a drug these days. It's used to help fight cancers and other things. But it's a non-specific way of going after things. In other words, it doesn't target just on one particular cell. It just encourages them to all come and get in on the fight. The complement system is another system that we have. Complement is a protein that helps, attaches onto different bacteria and then causes them to be easier to eat up and fall apart. We've already talked, I believe, about the inflammatory response, inflammation, that we talked about it a little bit. Dolor, color, rubor. The inflammatory response is a non-specific response. For example, if I bang my head on the table here, my fingers where it hit are going to get red and swollen, and they're going to hurt. They'll do all of those things. So, that's because there's an inflammatory response that's set up there. The body doesn't really know what to do about it. It's sort of it's a non-specific response. That's what inflammation is. Inflammation also would occur if you had a little infection in your finger, for example. You got another one of those splinters in there. First thing that would happen would be an inflammatory response. It would get warm, red, hurt, and you'd be sending all these fighters into the fight, so to speak. Fever is another non-specific defense mechanism. Our body fights infection better when it's warmer. That's why we run fevers when you get sick, because when you've got a fever of 101 or 102, that sort of makes all these defenses work better and allows your cells to go after and kill off the thing you're fighting. Oh, here we go. Inflammatory response is a localized response triggered by any stimulus that can kill cells or injure tissue. Here's the 4 cardinal signs of inflammation. You'll see this over and over in your training. Swelling is called a tumor, right? Tumor. Redness is called rubor. Heat is called calor, like calories or calorimetric or whatever. And pain is dolor. Anyway, those are just Latin terms, but they get thrown around a fairly large amount. But those are the cardinal signs of inflammation. You probably ought to know those because they're important. Non-specific defenses that we've been talking about here, they can block or attack any potential infectious organism, but they can't distinguish one attack from another. So they're not specific. They're very non-specific, and I think that's all the point I want to make there. Let's talk about the organization of the lymphoid system. Lymph is this fluid that our body picks up in these little lymphatic vessels, and they start down in your feet, and remember they're like one-way capillaries. So they have little slits on the side and little openings, and fluid can get into them, cells can get into them, bacteria can get into them, and then they gradually get carried up, and eventually they're going to be dumped back into your bloodstream up here in the left side of your chest. So these lymphatic vessels carry the fluid up. In the process of being carried up, it also passes through some lymphoid tissues like lymph nodes, little bitty lymph nodes. Usually they're very small and you can hardly see them or feel them when they get inflamed or get infected or anything. They can get really big. You've probably felt your kids' big lymph nodes when they had a cold or when you had one, or a sore throat or something. They'll get big swollen lymph nodes in their neck. Those lymph nodes are fighting the infection that's going on in their neck or in their throat. Other lymphoid organs would be the spleen. There's lymphoid organs in the intestines, which we'll talk about, and so forth. So, in the lymph nodes are nothing but big sacs of cells that fight infection. So mostly it's lymphocytes and phagocytes, some other immune system cells, but that's basically all lymph nodes are. Is just a big collection of lymph cells. Here's kind of a picture of the whole lymphoid system. Once again, these little ducts collect down here in your feet and start up. They go through, there's usually a bunch of lymph nodes in your groin here on both sides. Your appendix has a whole bunch of lymphoid tissue in it. In the small intestine, we have this stuff called malt. You need to know about malt. Malt is mucosa-associated lymphoid tissue. Basically, you might think of it as Peyer's patches, P-E-Y-E-R''S. Basically, it's a bunch of lymphocytes and lymphatic cells just below the mucosa in the small intestine. You may say, well, why do we need bacterial fighting cells in our small intestine? Well, hell, where do you think they're trying to get in? They're trying to get in through the wall of the intestine. So if any did get in, it's great to have that lymphatic tissue right there to fight them. So that's what that is. A spleen is this big organ that lives up here in your left upper quadrant. These lymph nodes from the lower body, these lymph ducts collect up in here in this kind of a little collection called the cisterna chyli. Cistern means like a water collection cistern. And then it goes on up through the thoracic duct, past the thymus. The thymus is another lymphoid organ, and it dumps right in. The thoracic duct empties into the junction here of the jugular vein and the subclavian vein coming from the arm on that side. Notice that there's a bunch of lymphatic running through the breast, and indeed, when ladies get breast cancer early on, the breast cancer hasn't spread. It's located just to the lump where the breast cancer started. but after a while that starts throwing off cancer cells, and your body keeps trying to fight them. The cells keep going to the lymph nodes, and the lymph nodes keep eating them up. But at some point, your body can't kill them all, and so then the cancer cells take up residence in the lymph nodes and start growing there. So when ladies have breast surgery, have a part of their breast removed or all of their breast removed, the lymph nodes are sampled under the armpit, and they're looked at under the microscope, and the lady gets the news about 3 days later, either her lymph nodes are negative, the cancer hasn't started spreading to the lymph nodes yet, or they're positive, which means that the cancer has started spreading into the lymph nodes, and obviously that's not as good. That suggests a poorer prognosis. And in the real world today, what that really means is you're going to get a hell of a lot more chemotherapy, and you're going to get a hell of a lot more radiation therapy if your nodes are positive, because it's not a good sign. It's a sign that says your body isn't doing a great job of fighting this cancer off.
I've had patients that I've had drawn, and they've had lymph nodes removed due to having a mastectomy, and you can't draw on that side.
Right.
Because it causes fluid back then?
No, it's because they can't fight infection as well on that side.
Oh.
If they were to get a little infection from you drawing blood in there, they don't have lymph nodes here to fight that infection as well. So you want to use the other arm. So basically, all that being said, one of the functions, like I just said, is to remove all this excess fluid. But another major function is to, and probably the main function, is to produce, maintain, and distribute lymphocytes. Because lymphocytes are those magical cells that are going to make these magical antibodies that are going to allow you to magically, truly be immune to many, many diseases. Lymphocytes are produced in the lymphoid tissues, like the tonsils. Tonsils is another place we didn't mention. The spleen, the thymus, and in the red bone marrow. So they're kind of made all over. Where do they live? Well, they live in all of those places too. So there's a lot of lymphocytes that are sort of floating there in your spleen. And if you've got an infection, those lymphocytes and other white cells would be released and go fight the infection. So the lymphocyte circulation, they go through the blood, but they also leave the blood and go out into the tissues. They can return to the venous blood back through or come back through the lymphatic vessels. Lymph is basically interstitial fluid. In other words, it's just water. It's got a very low level of proteins. Does have some, but lymph is basically interstitial fluid, the water between the cells that has entered a lymphatic tissue. From there, it comes up through the system, goes through the thoracic duct, goes into the vena cava, or the superior vena cava, and goes back into the system. What else does it do? Well, it also transports hormones, nutrients, and some waste products through the lymphatic system. Believe me, it is a very, very tiny system compared to your vascular system, your blood system, that has a heart and pumps and goes out and comes back about every minute and a half. You circulate your blood all around. The lymphatic vessels are very tiny. I didn't see them very often in my surgical career looking through people's tissues. They're just that small, and the fluid that's in them is clear, so it's not like looking at blood cells or blood vessels that are full of blood. How do they differ from regular blood capillaries? Well, first of all, they're not out and back, so they start as a pocket out there in the distal end of things, and then it's a one-way trip back. They tend to have larger diameters than you might think, and sometimes larger than just capillaries. They have very thin walls. That's why they're very hard to see. And when you cut them and see them under the microscope, they can be very, very flat and very irregular. This is kind of a diagram of that. See, they start off here as buds out here. It's not a two-way deal. It's strictly a one-way deal. So this extra interstitial fluid that's out here in the tissues goes into these lymphatic capillaries, and then it works its way up it's a one-way trip, as I said. Venules, capillaries, arterioles, capillaries, venules, that's a two-way trip. So here you go. Remember that the walls have little slits in them to allow this fluid in, but it's also real easy for lymphocytes to get their way into the lymphatic capillaries as well. They have a series of one-way valves in them, just the same as our veins do, only these are much tinier. And they work their way on upstream. I think is enough to say about it, really. Lacteals are those special lymphatic capillaries that live in the small intestine, and their job is to take fat directly out of the small intestine, absorb it into the lacteals, and then put it right into the lymphatic system, and then eventually right into the regular blood vessels. Here's a picture of a nice lymphatic vessel with a little valve in the middle of it, kind of like those valves in the veins that we talked about, the lower extremity. I can promise you I've never seen one of those, and I operated on over 7,000 people. I never saw one. They're just that tiny, that clear. Yeah.
So we shouldn't expect to see any in the lab practical.
Right. I'll see one of those on the lab practical. Good question. So anyway, just remember there's really only two major vessels that are in this system. One is called the thoracic duct. I mentioned it before. It drains everything from both legs and everything from the left arm. There is a right lymphatic duct. The right lymphatic duct only drains the right arm, which is kind of weird. So here's the relationship. So 3/4 of the body, basically, the fluid is all collected in through the thoracic duct and dumped back into the jugular vena cava, or subclavian convergence point up there. The tiny right lymphatic duct empties in to the subclavian over there on that side. I've never seen one of those either. We did operate on a thoracic duct one time. A patient had some kind of funny injury months before he met us, and he cut his thoracic duct, and it was such that he just kept pouring thoracic duct fluid, lymph, water, out into his chest, and he would fill his whole chest up with fluid, get short of breath, have to have a tube put in, draw all the fluid out, and usually you just expect him to kind of scar over and go away, but his didn't. He just kept getting it over and over and over again. So we finally had to go in and operate on it, go into his chest, find the end of that thoracic duct, and it's big enough you can see it, but it's still pretty small, and tie the thing off is what we did, and he did fine. After that, here's a picture of the thoracic duct. Here's the cisterna chyli down at the bottom where all the lymph vessels in the lower extremities and then the abdomen kind of come together. And then the thoracic duct comes up through here and it goes into the subclavian vein right there. That's just a close-up of it. I don't think, I've never seen, that one's been injected, looks to me like, with something that makes it yellow like that. So what is lymphedema? Lymphedema is when there's a blockage of some of the lymphatic ducts so that the fluid can't get up and out of the legs and people get swollen. You can get lymphedema in your arm, and some ladies who have had, back in the old days when they used to have a radical mastectomy, have all the lymph nodes under their arm removed, and then receive radiation therapy that would fry any little lymphatics that were left. In an attempt to cure breast cancer, they would oftentimes struggle the rest of their life with a really swollen arm. Bad problem. Yeah?
That's what they told us would happen if we drew on that side.
Well, it would only happen if they got a bad infection, and the infection scarred off all the rest of their lymphatics.
Okay.
Yeah. It's not really much of a problem anymore. I didn't see any. Even back in the last 10 years of my practice, I never saw a case of it. But from the 60s, from ladies that were operated on in the 60s and the early 70s that we were taking care of in the 70s and the 80s. They were the ones who had the problem like that.
Yeah, because I've got several patients and they'll tell you too. Like, I've had my second month, I don't touch it.
Yeah, well, that's what they were told to tell you.
Yeah.
And they're doing a good job. So that's what lymphedema is. I think I have some examples later of people with really big swollen legs from this problem. Lymphocytes make up about 20 to 30% of the circulating leukocytes, so of the white cells. So the differential of the white cell count, remember, normally it's 20 to 30% lymphocytes. A good point here, though, is that most of them are stored. They're not circulating around in your bloodstream. Most of them are stored in lymph nodes, in the spleen, in the liver, in the bone marrow, so forth, tonsils. There's three basic classes of circulating lymphocytes. One is the T cells, one is the B cells, and one is the NK cells. Now, know this. The T cells are called thymus dependent. That means they arose in the thymus gland, which is up here in your chest, not the thyroid gland, but the thymus gland. The thymus gland pretty much dissolves and goes away after childhood. It's very small later in life. It's done its job. It's made all its cells. They're out in the circulation by then. So when you hear the word T cells, that means thymus cells. That means that's where they started. Folks that have AIDS, that have HIV, the most important number in their life is probably their T cell count. And when their T cell count is up, that's a good thing, and they can fight infections really well. And if their T cell count drops down and gets really low, they're in trouble and they could fall prey to most any infection. The thing about T cell counts is that's what's used now to follow AIDS patients to some degree, so that when their T cell count is up, that's a good thing. They leave them on the medicines they're on. If their T cell count comes down, everybody scratches their heads and think, we got to make a change here. They change the doses or they change the drugs themselves in order to find a combination that will suppress the HIV virus some more so more T cells can live and take off and their T cell count can come up. Okay, so T cells are very important. B cells, they're called B cells because they came from the bone marrow derived cells, and they're important too, maybe just not quite as important as your T cells. The third kind is those NK cells that I mentioned, the natural killer cells. They really seek out abnormal cells and kill them. T cells make up about 80% of your circulating lymphocytes, so most of the lymphocytes that you have are T cells. They split this up further. I'm not going to make a big deal of it. I'm just going to mention these because you'll hear these words. Cytotoxic T cells are T cells that are made to kill toxic cells. They have helper T cells, and they have suppressor T cells that suppress different kinds of problems. Lymphocytes, as I've said several times here, I think, don't just stay in the bloodstream. They're constantly wandering out through the tissues. They are either going through the blood vessels or through the lymphatics to get around. This is an important fact here, and that is that lymphocytes can live many, many years. Many, many years. Now, why is that important? Well, if you have a particular lymphocyte that is the one that is designed to fight influenza B, okay, you would really like if that lymphocyte would stick around for lots of years so that you will be immune to that exact form of influenza B for 30 or 40 years. That's why it works that way. So these lymphocytes are very long, some of them are very long survivors. Yes?
What about with the flu shot? How long are those?
Yeah. The problem with the flu is evolution. The problem is evolution. The viruses are mutating and changing every year. The viruses want to live. And the only way they can live is if a lot of people have been exposed to them already, those people just kill them off. So the virus needs to change so that they can re-inhabit you. Say they were in you last year and you got immune to them, so they mutate, they change, so it's a different looking virus. Maybe it's not completely different, maybe it's a little bit different. That's why some years the flu shots work really, really well, and some years they don't work quite so high. It just it all depends on how much the virus has mutated in the year.
How long do you continue to be immune to the strain that you get in the flu shot, though?
Forever. Yeah, forever. But you'll probably never see that strain again either. I think I'll just skip that. Tonsils are a big deal. How many of you had your tonsils out when you were a kid? I remember when I first started working in the operating room, that it would not be unusual to see on one guy's operating schedule, Billy, Mary, Janie, Freddie, George, Smith, all 5 kids getting their tonsils out the same day. It really helped that doctor's college education fund. It probably didn't help the kids that much. Surgery used to be the most wonderful answer to most everything. And so everybody was getting their tonsils out, but the fact was it probably didn't help most people. Most people kind of need their tonsils. It's a good source of lymphocytes. And it's really good to have them out if they're way too big and you can't breathe right, or you can't close your mouth right, or you snore all the time. I can tell you that my granddaughter, Josie, was having 3 or 4 or 5 really bad colds a year. She was always, you could hear her breathing all the time. Every night she snored. This was at age 11 or 12. And I drew the short straw one day and was the one that took her to the doctor and about this. And we told her story, and he looked in her mouth and he said, "Well, young lady, your tonsils are huge." And that's the problem. They get so big that they get little pits in them, and they serve as a focus of infection. And they get so big that they block off things. Now, the main tonsils are called the palatine tonsils. They're the ones you can see when you open your mouth real big on either side. These pharyngeal tonsils are oftentimes called adenoids. So a TNA is a tonsillectomy and adenoidectomy. And basically the doctor just kind of reaches up there behind it, goes in through the mouth, pushes the soft palate up and out of the way so that he can see this area and takes that one out as well. You see that one blocks off the pharyngeal tube, that goes to your ears, that gives you middle ear infections. What do we call that tube? Eustachian tube, also called the pharyngeal tube. But yeah, so it's back there in the back of the nasal cavity. And so they take the adenoid out and they take the palatine tonsils out. And I can tell you that girl, it changed her life. It totally changed her life. She's never had another cold since then. You never hear her breathing. You never hear her snoring. And, she's the county champion in the 400-meter run. I mean, she's really, it totally turned her much more healthy than she was before. Anyway, so these nodules are found in these other places that I've already mentioned to you: the lymph nodes, the spleen, your tonsils, along your digestive tract, that malt, that mucosa-associated lymphoid tissue. Here it is right here. And then the appendix, also called the vermiform appendix. That's because it looks like a worm. Don't ask me. But your appendix lives down there in your right lower quadrant. We really don't know. I mean, our appendix is pretty useless in humans. It's very useless. But in some animals, even like chickens have a huge appendix. And it's a major source of their lymphoid tissue. They have lots and lots of lymphoid tissue in their appendix, which is 4 times bigger than ours, and we're bigger than chickens usually.
Hopefully.
Yeah, here's malt. This is what you'll look at under the microscope in the wall of the small intestine. This is called lymphoid nodules, but we always call them Peyer's patches, P-E-Y-E-R-S patches. We'll get to those later when we get to the intestinal system. So I think I've said enough about that. Let's talk about a lymph node here for just a little bit. A lymph node works like this. A bunch of these lymph vessels bring fluid into the lymph node from around the edges like this. The fluid kind of percolates through these areas of all these lymphatic cells, and then eventually gets up in here, and then it all leaves through this one efferent vessel. And in the process of going through there, any dead cells or sick cells or cancerous cells hopefully get eaten up by all these cells that are in there. Oh, here's another flash out of the past. Remember these guys, the dendritic cells? Where do they come from? Dendritic cells. This is a tricky one, remember I told you, because it sounds like dendrites. It must be some neural tissue, but it's not. Where are dendritic cells found? Oh, in the skin. They're found in the skin, remember? Go look it up. So lymph nodes are a filter. They work really well. They remove debris, pathogens, and all 99% of antigens, in other words, stuff that you might react to, is taken out there. Lymphadenopathy is a word that means swollen lymph nodes. So when your kid has swollen lymph nodes in his neck, that's lymphadenopathy. A lot of times if you have an ingrown toenail on your foot or an infection on your foot, your lymph nodes in your groin will be all swollen up and you can feel them just as easily. But basically lymphadenopathy just means swollen lymph nodes. Here's where the thymus lives. Remember, it lives sort of in the front part of the mediastinum, up high. Like I said, it's pretty good size in children, but in adults it becomes a smaller like this. It's very thin, and it's usually just fat. It's mostly just fat cells. So I know when we were doing heart surgery, you'd open it up, and if the thymus was in your way, you just kind of picked it up and cut it off and threw it away. Because it was in the way, damn it.
We don't need this.
Yeah. So what does the spleen do? The spleen serves as a place for lots of phagocytes and lymphocytes to live. One of the biggest functions of the spleen, however, is removing blood cells, RBCs. Remember, red cells, when they're created, they only live 120 days. And so you're constantly, millions a second, you're having to remove red cells from your circulation. Oh, that's the end.
No, there's more.
No, there's 54.
No, there's probably. Yeah, there you go.
No.
No, okay.
That's the end.
Okay.
So you just chuck it.
Yeah, just throw it away because we don't need it.
Okay. Now, that seemed kind of quick, didn't it?